Hello and welcome to this special presentation on how spinal decompression successfully treats disc conditions when other therapies have failed. And my name is Dr. Vince Leone, and so if you are suffering with some sort of disc condition, whether it's a herniated disc, a bulging disc, a degenerative disc, facet syndrome, stenosis, the list kind of goes on, but those are the biggies. If you're suffering from one of those conditions, you are in the right place, and this is going to be excellent information for you in terms of so you can make a well-informed decision about your health moving forward. Now, quickly, who am I? My name is Dr. Vince Leone. I'm a chiropractic specialist. I'm part of a group of chiropractic specialists, and we're all chiropractors for the most part. And everyone has, all of the doctors across the United States have invested the time, the resources into equipment, whether it's the decompression table and sometimes laser therapy as well, and the training to specifically know how to diagnose and treat disc conditions, and many times when everyone else has failed. So let's take some quick stats, take a look at some quick stats on back pain. This is back pain in general. We'll go into disc in a second. Affects over 30 million Americans, so it's a big deal. A lot of people affected, obviously. 8 out of 10 Americans will be affected at some point in their life with back pain. Now, common, like the kind of run-of-the-mill back pain is more common in women versus men. 54% reported from people that work at desks, right? So that's just becoming, there's even a saying now, sitting is the new smoking. Can you believe that? So it's just really hard on your low back to sit all day, right? Because then we get in the vehicle, and we usually commute, so we're going to sit in the car. Then we come home and we're going to sit at the dinner table and then sit on the couch. So the spine is meant to move. And here's a real eye-opening stat. 9 out of 10 patients never know the primary cause of their back pain. And why this is so important is because a lot of times you'll go to a chiropractor, you'll go to a physical therapist, or you'll go to a medical doctor, or sometimes even a massage therapist, but you'll never be given a diagnosis. You won't know if it's a sprain strain, you won't know if it's a disc condition, you won't know if it's facet syndrome, and so if you don't know what the heck it is, then it's really hard to make a good decision on who's going to treat your back, right? Because we'll get into that in just a second, but just kind of keep that in the back of your mind. Knowing what the diagnosis is really crucial in terms of choosing your treatment. So now let's take a look at stats on disc conditions. So more than half of older people examined with an MRI have some degree of disc bulging. So when we say older, we're thinking like 50 and above. 10% get surgery. It can take several months to heal. Now, with disc conditions, it's 2 to 1 men to women. Now, and if I had to guess why this is, probably because a lot of times disc conditions are stem from some type of like a physical injury, right? A lot of times it's at work, lifting something really heavy. It can come from car accidents. It can be from sports injuries. It can be slips and falls. It gets icy, you slip, you fall, you land flat on your back. All of that can have that effect. And then 90% of disc bulges occur in the low back. And that's something that we really see a lot, from a clinical perspective. So here's the primary conditions that we treat with spinal decompression, and then we're going to get into what the heck it is. So these are the conditions: bulging or herniated discs, sciatica, which is sciatica. So the sciatic nerve is the largest nerve in the body. So it's very easy to pinch. Comes out the lower back, travels all the way down the leg. So when we have a bulging disc or a herniated disc and it's putting pressure on that nerve, then we get pain that travels down the path of the nerve, right? Degenerative disc disease. So if for patients that are 60 and older, about 60% to 70% will have some form of degenerative disc disease. So this is very common, right? Because and degenerative disc disease is essentially where the disc loses its hydration, because it's 86% water. It loses its hydration, and essentially it kind of squishes down, and it's essentially not as tall, plump and strong as it usually is when healthy. Facet syndrome. So the facet is the joints that hold the spinal bones together. So facet syndrome then it's damaged in some way or it's degenerative in some manner. Pinched nerves, same thing as sciatica. It just would not be the sciatic nerve in particular. And then numbness, right? Sometimes even weakness in the back, the legs, the feet, numbness, tingling, burning, all types of these symptoms in the back, the legs, and the feet can stem from disc conditions. So the symptoms: pain, numbness, cramping, tingling, weakness, burning, aching. And again, this can be just in the low back caused by a disc condition, or it could be traveling down the legs. Now, and all the way to the feet. And the same thing goes for cervical or neck disc conditions. Okay, so in the most common disc that is herniated in the neck is C6. So there's 7 cervical bones in the neck, and so C6, C7 is the most common bulged disc in the neck. And so if there's pressure put on the nerves that are coming out of the lower part of the neck, that can then travel down the arms into the hands, causing pain, numbness, weakness, tingling, cramping, etc. Okay, so this is really, really important, and this is where it comes down to the differential diagnosis with the doctor or whoever is assessing your condition. How to tell the difference between a disc condition and something like a sprain strain. Okay, so that's a very common condition that physical therapists see and chiropractors see, right? And you can get a sprain strain from a car accident, work injury, sports injury. Does this sound familiar? So essentially a sprain strain is where the muscles, like due to the injury, is pushed beyond its natural limits, and it literally tears the muscle. So it's a strain sprain on the muscle. And this is really, really important because these will resolve typically in 6 to 8 weeks, right? So muscles, ligaments will typically heal in about 6 to 8 weeks. So, if you're seeing a chiropractor or a physical therapist and they're treating you for a sprain strain, you should get resolution within about 6 to 8 weeks. And so if you're not, right, if you've been seeing a chiropractor for a year, hopefully that's not the case, right? And you're not getting any better, or the pain went from an 8 just to a 5 or a 4 out of 10 on the 1 to 10 pain scale, it's probably a disc condition, right? Because it's not a sprain strain anymore unless you are continuing to injure it, right? If you're, say you continue to work, you didn't take the time off of work and allow it to properly heal, then maybe, yeah, it could be a re-aggravated strain sprain. But if it is going past that 2-month mark, then we start to think, okay, this could be a disc issue, okay? Now, if there's radiating pain, right? So pain down the arm or pain down the leg, or it could be just into the buttock or just into the groin or just down to the knee, that a lot of times is stemming from a bulged or herniated or degenerative disc. And again, and chronic, right? So chronic is typically over, anything over 8 weeks starts to move into that chronic phase. And again, not resolved by other traditional therapies. And when it's really high on the pain scale, right? It's a 9 out of 10 or a 10 out of 10, and you can barely walk, you can barely lift your leg, you're stumbling, you're tripping, those types of things. A lot of times that's a disc. And it affects your activities of daily living. These are really big. Right? So you can't work, you can't exercise, can't pick up your kids or grandkids, can't play a round of golf, those types of things. When the condition starts to limit that in a big manner and in an ongoing manner, then we start to think, okay, it's a disc condition. So what in the world is spinal decompression? Now, it has been around for quite some time, back since the 90s, right? And we have a tremendous amount of research from all types of excellent institutions, Harvard, Yale, Johns Hopkins. So in terms of the research, it's there. And then now you're probably all familiar with traction, right? So traction has been around since forever. And that's essentially where you're going to lay on a table and essentially it's going to stretch you. It's going to stretch your entire spine. So it's non-specific traction is. But the concept is similar. You can see the person on the table there. So on the top image, that is a decompression table. There's various decompression tables. This is probably the most famous one. It's been on the doctors and the various networks. And the real big difference between spinal decompression and traction is that spinal decompression is very specific to the level. So in other words, it's not going to stretch your whole spine. If you have a herniation at L4, L5, it's going to treat L4, the L4, L5 disc, okay? And so the other big difference between spinal decompression and traction is that spinal decompression is going to distract and release multiple times over the treatment time period. So, and typical treatment periods are anywhere from 20 to 30 minutes. And so over the course of a 20-minute treatment, typically you'll get about 13 pull and releases essentially. So, and what that does, this is the magic, okay? So please hear me on this. This is the magic of spinal decompression. The disc is 85% water. Okay, when we have a disc condition, bulged or herniated or whatever, and in other words, the disc then has lost water content. Okay, so in other words, it's no longer 86% water. It is somewhere less than that. It could be 50%, right, of that. And so think about, the best analogy I can give you is the tire on your vehicle. So look at your, just in your mind, picture the front left tire on your vehicle, and it's full of air, right? So say the PSI, or the pounds per square inch, is at optimum is 45 PSI. So picture that tire now, instead of 45 PSI, where it's as tall as it's supposed to be and as strong as it's supposed to be due to that air pressure, and it can do its job properly. Now picture it at 20 PSI. Now you're looking at a herniated disc. Okay, does that make sense? So now that tire, now it's not as tall as it's supposed to be. It's not as strong as it's supposed to be, and now it can't do its job properly, right? Can you imagine driving down the road with your front left tire at 20 PSI? Well, it's the same thing. You walking, running around with a disc that is, say 50% of its normal water content level. Back to decompression. Decompression, in that process of pull and hold, or pull and release, pull and release, pull and release, it creates a vacuum effect, right? It creates a negative pressure in the middle of the disc, and now it allows that disc to absorb water from the body, right? And get healthy again naturally. And by the way, if your question is then, because I hear this a lot, is what if I drink more water? Will that help? No. we're already around 70% water, right? Now should you drink water to be hydrated? Yeah, 100%. But it's not going to help your disc if you just drink more water. But it then absorbs the water from the body and gets healthy again. So that is the magic of spinal decompression. And so now the real question then is, well, what else can put water back in the disc? Nothing, right? Now, will some discs heal on their own? Yeah, some discs will just heal on their own. We don't know why, but they do. But physical therapy, while it will strengthen the muscles around the spine and the disc, it's not going to put water back in the disc. Okay? Chiropractic is not going to put water back in the disc. Massage is not going to put water back in the disc, and surgery is certainly not going to put water back in the disc. See, what surgery is going to do is they're going to come in and they're going to cut off that bulge. Okay, so you can see the bulge is pushing on that nerve root. They're going to come in and cut that off. Sometimes they'll do a laminectomy, right, where they essentially open this hole larger. The problem with this, and the reason why we have so many failed low back surgery situations, that we even now there's a term, failed low back surgery syndrome. So, that has to happen a lot to get a specific name for it. But the point being is, if all you're going to do is cut off the bulge, well, the disc is still not healthy, right? It's still not hydrated. And therein lies the problem, right? And so let's take a look at spinal decompression kind of in action, if you will. Let's see here. Okay, here we go. So you can see, right as we're going to push in, and I'm going to pause it right here, right? So we have the disc. You can see it's compressed. It's red just to signify that it's irritated, and it's putting pressure on that nerve, right? That's why it's red. Now as the decompression takes place, Pressure comes off, right? Pressure comes off, disc is able to plump up and get hydrated, and then the bulge is retracted back in, and the pressure comes off the nerve, and then that's when we have resolution of symptoms, okay? So, is spinal decompression safe? This is an excellent question as well. Absolutely, right? Because what happens is that now that rinky-dink machine in that video is not the type of machine that we use. The large DRX, we like that. We like the AcuSpina. We like the dock table is a good one. But the point being is there's an algorithm. There's a computer associated with the machine. It has an algorithm that your height, your weight, the level of involvement, is all that stuff is put in there, and it's going to then essentially target that level and start the process. But the machine will cut out at resistance. In other words, if your body is fighting it, it's going to just stop. Okay, and it's very gentle. Patients usually fall asleep. Right? It's the first time they've ever been out of pain. Right? And so an excellent recovery rate, anywhere from 80 to 90%. And again, tremendous research by some of the top institutions in the country, namely by a doctor named Dr. Sheely, who is a medical doctor. Okay, he's not a chiropractor. In fact, spinal decompression was not even created by a chiropractor. So we have just kind of taken it on as our own because the spine is our specialty. So now here's another big question: is it covered by insurance? No. Okay, I don't know why, and I just apologize in advance. Patients are always so disappointed. They're like, "Oh my gosh, this sounds so amazing. Does my insurance cover it?" No, it doesn't. Why? I don't know. I can't figure it out. I stopped trying to figure out insurance companies. Insurance companies are just there. They're not there for our health. They're really there to make money. Insurance is a necessary thing that we have to have. I kind of liken it to like a LASIK surgery. That would be phenomenal if LASIK was covered by insurance, right? But it's not. It's an elective procedure, and spinal decompression is as well. So then I'm sure you're going to ask, well, how much is this then? It sounds great. So the price range is anywhere from $75 to $125 per visit typically. Okay, that's just kind of the average range across the United States. And then the doctor will determine when you come in to get an evaluation, it'll determine the severity of the condition, are you in good health, like all these types of things to determine how many visits you need. And they can, the number of visits can range anywhere from 15 to 30. I mean, just depends on the severity of the condition. So how to determine if you're a good candidate? You need to be evaluated by a specialist, okay? And again, that's if you're watching this video, there is a specialist in your area then, okay? So that's the good news. Now, how do you determine if you're a good candidate? Patient history, examination. We're going to review imaging. We're going to do specific orthopedic testing specifically for a disc condition. And MRI is really the gold standard for disc conditions. So we really like to see an MRI. We are able to work off an x-ray, but MRI is preferable. So what to do now if you're interested, if you have a disc condition, or maybe you've been suffering with some of those symptoms that we talked about, and it's been past that kind of 8-week time frame, and you really want to kind of take action and figure out what the heck is going on with your body, somewhere on this screen there is a button for you to find a provider near you and schedule an appointment. Okay, but before you do that, we have a survey. Okay, and it's a very brief survey. It's like 5 questions where we're just going to ask some good qualifying questions, right? Because then that information will be sent on to the doctor that you ultimately schedule with, and then he'll be working, ahead of the game a little bit because he'll already have some good information about what's going on with you. So again, I'm Dr. Vince Leone. Thank you so much for taking the time to watch this educational video on disc conditions and how spinal decompression can help when no other therapies can. If you are suffering from one of these conditions, I highly encourage you, take the survey and then go ahead and get scheduled to come in and have an evaluation to determine if you're a good candidate for spinal decompression as well. Okay, I wish you all the best in health. Take care.